Hello, my name is Dr. Jason Patton. I'm a board-certified orthopedic surgeon here at Orthopedic Institute of Western Kentucky. And I'm here today to talk to you about a common ailment that affects a number of people involving the lateral aspect of your elbow, which, if you look on my arm here, is over the outside part of the elbow. And we'll refer to a diagram here that we have pulled up on the computer. Lateral epicondylitis is somewhat of a misnomer in that it's not typically an inflammatory problem over the outside part of the elbow, but it's more of a degenerative problem that affects men and women equally. It is mostly in the dominant hand. There's a number of different variables that they think could contribute to the development of lateral epicondylitis, but a lot of it is overuse and repetitive activity. Most patients will present with pain over the outside part of the elbow. It's worse with the elbow extended out away from your body, lifting or gripping anything. One common complaint or report that we'll hear is, I can't even lift up my cup of coffee in the morning. And so most of the time, upwards of about 80% of the time, these patients and symptoms will get better within a year's time without any treatment. But in a small subset, those patients will present requiring additional treatment or with additional questions. And so most of the time what we do, or what our treatment techniques are geared towards, are conservative management. So physical therapy. We do consider anti-inflammatories, even though this is not particularly an inflammatory condition. Used to, we would consider some corticosteroid injections, and we still will from time to time, but newer studies have gone away from recommending those. We've done braces, we've talked about therapy exercises, and then even still yet, if patients have had persistent or severe symptoms upwards of a year, there is an operative treatment where we can make an incision over the outside part of the elbow. And the tendon of concern is this darker red tendon called the extensor carpi radialis brevis, or ECRB tendon. That tends to be the tendon of concern. So we can go in, and what we will do is debride that degenerative tissue. Some newer techniques have even looked at doing that through a scope or arthroscopy. But either way has shown to lend good results. The recovery can be relatively quick. We typically see patients back 2 weeks from surgery, place them in a removable wrist brace, get them started back in therapy, and you're looking at maybe a 2-month recovery and return to activities as tolerated.